Hi, my name is Mallory, and today I'm going to be demonstrating the dressing change on a chest tube. So first thing we would want to do is gather our supplies. So just so you can see what I have here. So we have drain sponges, regular gauze sponges, a petroleum gauze, swab sticks, sterile saline, gloves, a biohazard bag, and a pair of sterile gloves. And I'm just going to grab some tape here. And we have some tape as well to hang up our biohazard bag. We also have this pressure tape. Normally it would not be pre-cut like this. For video purposes I have it already cut, but normally you do want to use a no-touch technique when placing this so that you keep the inside of the dressing as sterile as possible. So I'm going to go ahead and enter the patient's room. Hi John, my name's Mallory. I'm going to be your student nurse today. We have an order here to get your dressing changed on your chest tube. How does that sound? He says that sounds great, so I'll go ahead and prepare a seat and some hand sanitizer. I'm going to wash my hands. And John, can you give me your name and date of birth? And he does, and I'm checking it against his ID band as well as my mark. Everything matches up. And how about any allergies? Do you have any allergies or sensitivities? He says no, so we're good to go. One thing you'd want to be sure of is we're using a sterile saline in this case, but if they were using a medicated cleansing solution, you definitely want to double and triple check that he doesn't have any allergies or sensitivities to that cleansing solution. So we will go ahead and get started. So I've washed my hands. I'm going to put some gloves on. And we're going to take a look at his dressing here. So just going to uncover what's absolutely necessary. And without dislodging the tubing, so making sure that you're anchoring the tubing, you can start to remove the dressing here. So we'll pull it up. And being careful not to touch the insertion site, we can pull out the old dressing. So once you have the old dressing off, you're going to want to inspect it for any drainage. We're looking for color, odor, consistency, amount. Something we would also want to document at the end. In this case, there's not really an excessive amount of drainage. So we can go ahead and dispose of this in a biohazard bag, which I have right here. And I'm just going to go ahead and tape this up so I have it ready in case we need it to dispose of anything else. And so once we have the dressing off, we also want to check out the insertion site, and we'd like to observe for any signs of infection, so any redness, swelling, tenderness, anything like that. And we also want to take a look for any crepitus that might be there. To do that, you want to palpate around the site. And it would just feel like Rice Krispies under the skin. And you want to move up into the shoulders and probably the lower part of the neck and just make sure. And in this case, he's good, so we can go ahead and move on. And John, how are you doing? How's your pain? He says it's okay. So we will go ahead and remove our clean gloves. Wash our hands. And put on another pair of clean gloves. Making sure to palm the label. And just pour a little bit of sterile solution. Being careful not to touch the end of these. We'll place those in the sterile solution. And once we have them in there, we're going to go ahead and clean the insertion site. So, working our way from the center of the insertion site outward around the tubing. Okay. And if there were any excess drainage, we could certainly use more of those cotton-tipped applicators. So once we have the insertion site clean, we'll go ahead and remove our gloves and wash our hands. And now, depending on agency policy, we could use some skin prep. I would say that if it were an older client with more pliable and fragile skin, I would absolutely want to use skin prep to protect the skin and create that barrier between the tape and the skin. So I have my hands washed. I'm going to go ahead and prepare my sterile field. Being sure not to contaminate the inside of these packaging. Just open them all the way. So once we have those open, I'm going to go ahead and apply my sterile gloves. Now that I have sterile gloves on, I'm going to pick up my petroleum gauze, and I want to make a ribbon, a longer ribbon. and making sure I'm not touching anything else. I'm just going to add the sterile dressing from underneath and just bring it up and wrap it around. Making sure not to touch the insertion site. Next thing I'll grab is my drain sponge, and using the same technique, I'm just threading it around the tube. And then I'll place my regular gauze right over the top. So once we have the sterile part of it complete, we can remove our sterile gloves and put on clean gloves, but really these would be considered clean gloves at this point, so I'm just going to continue. I'm using, once again, the no-touch technique. I would rip new pieces of the pressure tape and just making sure that it's nice and tight. We'll go ahead and apply the tape for the new dressing. Okay, and right away I want to make sure we label it with the date and time and my initials so that it's very obvious that when it got changed. We'll go ahead and remove our gloves and wash our hands. And I'm going to place him, well, maybe not. I would put him in a semi-Fowler's position to make sure that he has proper drainage. I'm going to inspect the chest tubing while I'm in here, make sure there are no dependent loops. I would probably also assess the amount and quality of the drainage that's in there, mark it, anything like that, and then I will clean up also my supplies in the appropriate area, wash my hands, and make sure he's comfortable, bed in the low position, call light it's within reach, and I would go ahead and document. Just going to document date and time that the dressing was changed, any assessment findings, and how the patient tolerated it. And that's how you change a dressing on a chest tube.